Hello, I'm Dr. Kelly Roush, a certified chiropractic sports physician and certified athletic trainer at Holzer. Traumatic brain injury is a major health issue in the United States. In this video, I'd like to go over our process of concussion evaluation and the proper steps needed so our patients have the best recovery possible. At the time of injury, Holzer Sports Medicine team physician and/or trainer will evaluate the athlete to determine if they have a head or neck injury. If a head or neck injury is suspected and further emergency evaluation is needed, an ambulance will be called. The athlete will be placed on a spine board to prevent further injury, and the athlete will be transported to the local emergency room. The EMS personnel will radio all information to the ER prior to arrival. When an athlete shows signs or symptoms of a traumatic brain injury at halftime, after the game, or during the game, and no neck injury is suspected, I may perform an infrascan to determine if there is a brain bleed in addition to neurological, cognitive, and balance testing. Prompt detection of a brain bleed can expedite emergency care and possibly save a life. The ER physician will evaluate the athlete upon arrival. X-ray of the cervical spine is performed to rule out a cervical fracture. After X-ray has confirmed that there is no fracture, the helmet may be removed and the ER physician may order a CT of the head or neck and/or infrascan of the head to rule out an acute brain bleed. If a brain bleed or spinal fracture is present, the athlete is immediately transferred to a Level 1 trauma center for immediate neurosurgery consult. The athlete is given follow-up instructions by the nursing staff and referred to a sports medicine trained physician or pediatrician for return to play decision making. If there is an abnormality found on any ancillary test or an athlete is unstable on exam, our neurologist or radiologist is consulted. When the athlete arrives for follow-up care in my office, they will be given a history form which is to be completed solely by the athlete. This history form will ask about the current injury, signs and symptoms at the time of injury, and at the time of examination. Prior care given, past history of any problems, and any congenital problems or health issues that the athlete may have. There is also a short written cognitive test included with this history form. I will review the history with the athlete and his or her parent, and then perform a thorough neurological examination of the head and neck, and will review any ancillary testing and results. Examination often includes history taking, neurological exam, a modified Romberg's test, balance testing, testing of cranial nerves, and sensory motor testing. I may also perform an infrascan to evaluate for an acute brain bleed. I will also perform an examination of the cervical spine, go over x-rays with patient, perform range of motion testing, motion palpation, orthoneurological testing of the cervical spine. Chiropractic adjustment of the cervical spine may be performed to correct misalignment caused by trauma to the head or neck. Patient will be sent to the exercise room for demonstration of stretches to be performed 2 to 3 times daily during the recovery process. Muscle stimulation with ice may be applied to the cervical region to decrease spasm of the cervical paraspinal muscles and decrease any swelling present. I will then have the athlete perform an impact computerized concussion post-injury test, which will be compared to a baseline impact cognitive test that is performed prior to the season at the local school. I will then review all results with the athlete and parent and give written instructions for home, school, and athletic participation, which most often includes complete rest for 1 week, no video games or anything that would cause tedious focusing, concentration, or rapid eye movement. I will communicate instructions in writing to the school trainer, coach, and will keep in close contact with the trainer regarding the progress of the athlete. Follow-up examination is performed typically 1 week later. Neurological testing, balance testing, impact testing is repeated, and if no signs symptoms of concussion have been present for an entire week and the athlete is cognitively back to their impact baseline, then the athlete is tested both at rest and post-exercise. Exercise consists of supervised physical activity for 15-minute duration. The same exam is performed post-exercise, and if the entire exam is normal, the athlete may be returned to light activity such as walking. Progression to jogging, no contact with close monitoring by his or her trainer. If there is no signs or symptoms with light activity, then the athlete progresses to moderate activity, and then to full conditioning, no contact, and then to full contact. Athletes are observed carefully after full return to play for any return of symptomology. The athlete and parent are educated on the danger of continuing to play with known symptoms, informed about second impact syndrome and the long-term effects that repetitive hits can cause. They are educated on proper stretching and strengthening of the neck, and sports equipment is evaluated to make sure that it fits properly. Thank you for watching this educational video. At Hoser, we are dedicated to the safety of all athletes, and our goal is to get you back in action.